Okay, whenever you're ready, go ahead.
Okay, so my name is Angela Braz, and I am the Worksite Wellness Coordinator for Partners for a Healthier Community. What is Worksite Wellness? Worksite Wellness is an organized program in the worksite that is intended to assist employees in making voluntary behavior change, which reduce their health and injury risks, improve their health consumer skills, and enhance their individual productivity and well-being. All right. So yes, we're to data. No, we can go to the data slide, great. So the cost of unhealthy lifestyle choices. And any of the work that you do in the community, especially if you work for a non-for-profit, you need what? Oh, yeah, you need money, but how do you get the money? How do you show them the money? Or how do you ask for the money? What do you need? What do you need to show them?
Need data.
Thank you. Data. Data, 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 data. And I threw this in here because this is one of the charts from the article that I gave you, which that article was extremely lengthy. However, if you take bits and pieces of it, you'll gain the overall knowledge of Worksite Wellness. This gives you a bunch of numbers that tell your employer how much your employees are at risk. And what are they at risk for? It could be any of these are the top ones for the unhealthy lifestyle choices. This is what's driving the healthcare costs. But when you ask for money, specifically when you're a non-for-profit, you need to show them data, and numbers rule, even though you could verbally go in and be like, I've been to every work site in this area, and specifically the small businesses are really hurting and they need tobacco cessation. You can't say that to them. They're going to look at you and laugh. So you need to show them numbers. And the way we get numbers is we assess them. And I'll talk about assessment more later as well. And assessing them can be done through a health risk assessment, which is considered a survey, basically. So I come in, I survey all of you, and I ask you what you want and what you're interested in. But I also find out where your health concerns are. And it may be different for every single work site will be different. That's what I want to make a point of. Every work site will be different. So next slide. All right. So the interventions that I can go into work sites and offer are around active living, healthy eating, managing stress, and avoiding tobacco. And how do we do this? Like I said, the survey, the health risk assessment. The reason we've gone into work sites, Marcia's in the schools and Dave is in the overall community. And they hired me to do specific work sites because how many hours a day are you at work?
80.
Yeah, 80 or more. Like, you're spending most of your waking hours at work. So why not go directly to the work site, to the employees, and find out what their needs are? The tricky part tends to be which work site to go to, but also what time of day. You're going to find that if they're working, you have to either go before work, after work, or during lunch. But most people want to leave after work, right? You don't want to hang out and do like a lunch and learn program, or you don't want to hang out and do a walking program necessarily. So you really need to find out what's going to work for each work site, but also when's the best time to connect with them. Okay. So where to begin? This is from the Massachusetts Worksite Wellness Toolkit. There are many components to a Worksite Wellness program. I have taken different pieces from each step here, and I've been able to implement that into work sites. So if you go into any small business, you know, they're not going to be able to do this step by step because they don't even have an HR department per se. And usually when it comes to Worksite Wellness, your HR department is your go-to. But they have a ton of other hats that they carry as well. So in any event, all right. So no, go back to that one, sorry. I'm just looking at my notes so I don't forget anything. All right, so the first one is obtain a mandate. And what this means is that you're gaining support from senior management. When you decide to compose a Worksite Wellness program or do something on site, you need senior management. Why do you need management's approval? Does anybody know? Just like off the top of your head, why would you need management's approval?
Because that's how you're going to get the money to begin with.
That's right. Because we need money to run the program. We also need support, because if the boss is doing it, other employees should follow. You know, it's sort of the take the teachers. What's the word I'm looking for? Take the teacher as your, as who you would follow. As the model, thank you, as the model, and then go from there. So that's to ensure that you get money, resources, and participation. The other thing we like to talk about when I go into a work site is we talk about this culture of wellness. And when you have CEO or owner buy-in, you want to be able to educate that owner about a culture of wellness and why it's important to keep your employees healthy. And that all comes back down to education, because that owner does not know. The owner knows how much profit they made last year, but they don't know why they should keep their employees healthy. So next thing would be compose a wellness team. This role is to communicate, participate, motivate, and support the Worksite Wellness program. Some important factors in a team is to write down specific job descriptions. So what I tend to do when I go into work sites is really focusing on wellness champions. And when you go into a site, you're gonna find that there's like 1 or 2 people that lead healthy lifestyles, and then the rest are kind of floating in the wind or picking up P90X or picking up CrossFit or Taekwondo or whatever they decide to pick up for that week, because they're working on their own health goals. You want to also engage them. You know why? Because they're going to be the wellness champions as well as the smokers and the non-smokers. So when you compose a wellness team, you want to have a diverse group of people. You also want to have a diverse group that's management, non-management, union, non-union, different shift workers. So granted, you're going to have a wellness team that has one administrator on that team, but you want to be able to have a shift worker on there, because you need to hear their voice. Why is their voice important? Even though they may be, you know, like a low man on the totem pole. Why would their voice be important? What's a big thing that you want the employees to do when you have a program? Say you have this brilliant idea to do a walking program. What would you need to fulfill that program?
Participation.
That's right. That's a huge factor. Participation is a huge factor, and that's one of the biggest problems with wellness programs is nobody wants to participate. You kind of have to like dangle the fruit in front of them, and we'll talk about incentives in a minute. All right, so you compose your wellness team, you have dedicated leaders, you've found your wellness champion, you've wrote down definitions of what the job description is. So along with you being, you know, an employee there, you're also a part of this wellness team, and you're going to be the leader in the Couch to 5K program. Example. Okay. So now we go to identifying the needs. And this I talked briefly about, and the purpose of this step is to collect pertinent information that will support the development of the program plan. Data is always helpful at this point and can be collected by healthcare providers. This will help you make your case to senior management when you do the ask. So we talked about the surveying and the health risk assessment. That's really important when it comes also to insurance providers, because again, they look at data and data rules for the most part. Most work sites can have me come in and do a health risk assessment, and small businesses specifically. Otherwise, they go through their insurance companies. And Blue Cross Blue Shield, Harvard Pilgrim, all of them are like more than happy to come in and assess their employees on site. And it's usually done during a health fair, but it can be done during open enrollment or not. There's a lot of flexibility. So you identify their needs, and all of the health risk assessments that we do are anonymous, which is really important because some employees may not feel comfortable, you know, divulging their health information to their employer, and that's really important to convey. So the next thing we do is we formulate goals. Has anybody heard of SMART goals? Is anybody teaching degree here? When you're a teacher, you have to do SMART goals. Subjective, measurable, in any event. So goals, the purpose of this step is to define the goals and objectives for the program. SMART goals is what I tend to focus on because they're measurable, and again, you need data to get your money to get your program funded. What was I going to say about goals? Just lost my train of thought. That's right. When you write your goals within your wellness program, what would be an overall factor as far as like a timely SMART goal? When you have, like, say it's January, it's the beginning of the year because January is coming up, it's a new year, and you've composed your wellness team and whatnot, and you're sitting down and you're actually thinking about doing a Couch to 5K program or a nutrition program, and you say to yourself, what would be a timely goal to write? Like, how would you encompass time into that? Would you focus more on when to promote the program, or would you focus on time of year? When would you focus? What would you think, give or take? Because the subject, when you formulate the goal for the program, subjective, measurable, SMART goals.
Excuse me, I'm just going to write that over here.
Yeah, so they know. Good idea. Timely is, I would say, besides measurable, one of the most important things, because granted it's January and it's cold out, and say you do a Couch to 5K program, you want to be able to offer that program probably in the spring. So timely is a huge component of it, and most work sites jump into things and they just think, hey, we're going to do this program tomorrow, we're going to get everybody to participate, and it's going to be great. And that's not the case. You have to really meet the employee where they're at, because everybody's at a different point in their life. So the next focus would be to formulate a Worksite Wellness program would be to formulate a plan development. Plan development is the longest and most important step, and this can be so boring, but you have to do the planning because it helps you succeed when you implement it, okay? So plan development is the next step to identify the individual interventions for each objective and define evaluation activities. It is important to note that a hallmark of a successful Worksite Wellness program is that it is available to all employees, regardless of health status, language, work shift, or level of ability. So when you do formulate a goal, you want to plan on when to present it, but also developing how you're going to address each employee. And I like to use the example of one of my work sites that's a fruit company. They're Nassif Fruit. They're over here on, what is that road? I don't know the name of it. I think so. They're right near Stop and Shop. What is it? Thank you. So they have been in this community for over 30 plus years. They're a family run company. They're very small. They deliver fruit. The majority of their employees are truck drivers, and they all smoke cigarettes, and they all would rather pay the Massachusetts Department of Health money instead of enrolling in healthcare, and they can't be bothered with any of this. So when I went in and did an assessment on them and went in and talked to them, a lot of these employees wanted to quit smoking. They just didn't know where to start, and they didn't have the materials. That's another component, is materials and whatnot. So in any event, you know, a successful Worksite Wellness program, you have to think about all of your employees and meet them where they're at. Because some of these employees also, specifically at that fruit company, they worked different shifts. And sometimes they worked an overnight shift. And so you have to think about, I like to call them the night owls. So you have to think about them and what's going to work for them as far as their wellness goals. So next we go to plan approval. And this task is to seek approval for the plan from the wellness team, the program sponsor, and the organization's management. And this is just to kind of cross your T's and dot your I's and make sure that you get approval before you implement it, which is really key in case anything falls apart, so you can go back and kind of figure out and can brush up. The last step is to implement the plan. Implementation will convert planning goals and objectives into action through administrative structure, management activities, policies, procedures, regulations, organizational actions of new programs. When you implement, I think a key thing with this is to have the wellness team all implement it. So you may have one person that's on your wellness team that's like your go-to person, which is usually the HR director, but you really want all employees that are on the wellness team to be implementing the program. All right, so next one. Direct services, okay. So we talked about CEO buy-in and employee participation. At specific work sites that I go to, again, work sites within Fall River that I've offered services for, we've done back care and injury prevention, we've done physical exercise. Have any of you heard of the Fall River Fitness Challenge? Yeah. Okay, great. And then we also offer stress management, tobacco use, and blood pressure, cholesterol, blood screening, and blood glucose screenings. Hold on one sec. Collaboration is key. This is my favorite one. Okay. Since I work for a non-for-profit and I am the only sole Worksite Wellness coordinator, how can I juggle all hats? How can I do blood glucose screening and stress management and lunch and learn programs? I have to collaborate, basically. And the way that we do that, I don't know if Dave and Marcia talked about it, is we connect with our local health and human service organizations, and one of those is South Coast Hospital Groups. And they have a great team that offers on-site screenings, BMI screenings. So we usually go into a work site and we can run a health fair, or we can just have a basic health day, and we have employees come in and we do cholesterol screening, blood pressure screening, and blood glucose screening. Why do we focus on those three? Do you guys know? Like, why wouldn't we focus more on, I don't know, their gender or their weight? Why do we focus on the big three, the cholesterol, the glucose?
Because that's everything. Your blood pressure can tell a lot.
Yep.
Your physical.
It is a huge component, but one of the huge healthcare prices, what's driving the healthcare prices to be up so high?
Heart attack, cardiovascular.
Diabetes.
That's right. Diabetes, high blood pressure, which is hypertension, and then the other one would be the cholesterol screening. So since we go in and look at those three things, we want to reduce diabetes. And usually type 2 diabetes is the most prevalent right now. So we do that. And what we like to do is we like to catch it early, which is primary prevention. Have you guys heard of primary prevention? Primary prevention is basically catching it before it starts. And then secondary prevention, and then there's tertiary. And our healthcare system right now works on a tertiary level. And what that means is that we basically treat the disease, which is costing us a ton of money. So if we can catch it early, that's what we want to do. So the other collaboration that I want to talk about is the South Coast Human Resource Council and the South Coast Worksite Wellness Collaborative. So the Human Resource Council is a great group of human resource administrators, and they all sit on this board and we collaborate. We talk about what works, we talk about what doesn't work. They meet about once a month, and they meet very early in the morning and they talk about everything related to human resource, and they have guest speakers, and I've joined that group, and they're a great group, and it's all human resource staff from each work site. And some of the work sites are not from not from Fall River, but they're also from New Bedford and Somerset, and some from Swansea. That's why we're called the South Coast, because we don't specifically focus on one community. The other collaborative that I actually run and am on is the South Coast Worksite Wellness Collaborative. The biggest focus with that is we do an annual Worksite Wellness Conference every year in May, and that is just refreshing the work sites all about what's going on in the industry. And the biggest thing that we've been focusing on recently is the Massachusetts Prevention Wellness Tax Credit, which they're trying to engage small businesses to offer worksite wellness on site, and they're tying an incentive to it, and that is $10,000 tax write-off at the end of the year if you implement the program. They, again, help you implement the program. A little bit of a caveat is that you have to have money up front to run the wellness program. And along with Worksite Wellness, there's a level of ROI, which is called return on investment. And usually what happens with that is it takes 3 to 5 years to see any ROI. So here I am, a Worksite Wellness coordinator. You own a small business. I walk into your business and tell you it's going to take 3 to 5 years to see you reap that money that you just shelled out. That's a huge barrier in getting employers to be engaged, to really kind of bet that money down because they may not see a return on it. But we like to inform them and collaborate with them so that they can hopefully join and drink the Kool-Aid and, you know. All right, so next slide.
Can I ask
yes,
you a question?
Please.
Does DPH offer any
incentives?
Assistance with small businesses?
So this is their first kind of helping hand in a sense with the Worksite Wellness with small businesses is the tax credit. And the way that they defined a small business is I believe 200 employees or less. So if you have 200 employees, you can apply for this tax credit. If you have 201, you can't. And we've found that there are some organizations that are in need of this tax wellness credit and would qualify, but they're just a little over the cusp of the amount of people. There's other things that DPH has put into place as far as contingencies that would, qualify you for the tax credit. So that's how they've helped, specifically with small businesses. For larger businesses, they've helped a ton. So we're still, we have a representative from DPH that sits on our collaborative, and that comes every month, and she's great. Her name is Claire, and she has helped us as far as, communication and whatnot, because a lot of what we do mirrors what DPH pushes for the communities. We don't get our marching orders from them because, again, we're a non-for-profit, but we tend to mirror what they want into the community. So, okay, policy change, one of my favorite things. So, does anybody know what policy change is? I mean, I know it's kind of a political, you think of politics, but what would be a policy change, or is anybody interested in policy change here? It's definitely, one of those things that can be a little difficult, but the best thing about policy change is that if it's written down, then it's a mandate. And what do we like about mandates? People have to do it, right? Okay. Even though it's written down, people are not going to do it, so you have to engage them. But the reason we like policy change in the realm of worksite wellness is because it helps people with healthy behaviors. And one of the mandates, which is in effect here at BCC around tobacco use, which is a policy change here, is what?
No smoking.
That's right. You know how they can get away with that? Because they wrote a policy. So that's important, just saying.
Not an enforced policy.
That's right. And that's another thing. Just because it's written doesn't mean it's enforced, but also just because it's written doesn't mean, that it's going to be changed overnight. It's a culture of wellness and a culture of change. And the way we can get there for the future, for our children's future, is by engraving these policies now. I mean, they used to smoke in hospitals back in the day. And now, you would probably scream at your doctor if they lit up a cigarette while talking to you about your stress level and your stats and all this other stuff, right? Because that's what you're used to. back in the day, it was the norm, right?
In my day.
All right. So I can go into the work sites and I can do a jazzy health fair. I can go in and survey. But really, to get the work done, the hard sweat and tears, you need policy change. And that's what I drive my work sites to do. And I start off very small. And one of the things I like to tell them to do is to write a policy around tobacco. And some sites have decided to go tobacco-free inside their work sites, but around the perimeter, or the employee can go into their car and smoke, they've allowed that. Or they've done designated smoking areas. So I work with the employer. I have one work site that the name's not going to come to me. They make blinds in Somerset. I'm trying to remember the name of them. They have a huge rate of employees that smoke there. And I just finished up, before I went on maternity leave, I finished up an 8-week smoking cessation program, great group of employees. And one of the things that is in their written policy is that they have designated smoking areas. Now, I was trying to drive them to go all tobacco free. And one of the barriers they told me, what they feared for, was that the employees were going to sneak to the back of the building and smoke. And what's in the back of the building? A significant amount of trees. So the employer was worried that the whole forest, whatever back there, was gonna catch on fire. And I was like, that's crazy. But that's one of the reasons why they still kept their designated smoking areas. And I couldn't change their thinking on that, which was fine. I took what I could with it and went with it. But for you to have a designated smoking area at your work site, you're still honoring that behavior and you're allowing it, which is saying it's okay to smoke, which then in part your healthcare costs go up. And that was one of the huge factors that they brought me in, was because as of January 1st of next year coming up, if you're a smoker at their work site as an employee, your health care is going to go up $5 a week. So a lot of the employees were like, help me quit smoking, or option B is you're going to pay out of pocket for it. So that's, money kind of is the driver right now for some of the work sites that are looking for wellness programs, because of the driver of healthcare costs. And as we all know, the Affordable Care Act is a whole nother ball of wax that I won't go into. You guys will definitely be snoozing. Okay, so let's see what we have here. Another component for a policy change is vending machines. Are there vending machines on campus? What's in them?
Cookies,
Soda,
candy,
chips.
soda.
All stuff that spikes your sugar and then you're like, crash. Yeah, that's not fun. You could, as a group, come together with a healthy vending machine policy, and you could present it to the wonderful administrative staff of BCC and say, listen, we want to change the culture of wellness here at the campus. That is an example of a policy change. And let me tell you, it works, because we have gone into work sites and we have changed their policies. And specifically, one of the work sites that we went into is St. Anne's, and they're a hospital, so you think that they would have healthy items in their vending machine, but they don't. They don't even have healthy, they just got rid of their fry laters actually in their cafeteria, which is a huge stride, The school systems in New Bedford, they've done great strides around policy change and healthy vending and healthy options. Again, all government, public-run organizations, so it's easier to do policy change on that prospect. St. Anne's went ahead and did a healthy vending machine initiative, and we helped them with that. One of the things that they did, because they knew they couldn't take it all away, because if we take away everything, then people are going to be chomping at the bit, is we kind of paired education with it. And how we did that was, you have options in a vending machine. How do you make a healthier option? You color code it. So what we did was we did red, yellow, green, and obviously red would be the more non-healthier option, and then green would be the healthier option. And water bottled water was the healthiest, and then soda was the red option, obviously. So by educating them, we were hoping that they would be able to make the healthier choice, because making the healthy choice is the easy choice. All right, so the other thing I wanted to talk about was, I talked about tobacco-free, but meetings and catered events. And this is a great segue into Christmas time, because what happens at work sites?
Christmas party.
Do you guys work part-time? I know I worked part-time in college. Who works part-time?
Pretty much full-time.
Okay, or full-time for that matter, and you're in school, you're working your butt off. You get into your work site, and what's there, especially at this time of year?
I work at a pizza place too, so.
Okay, even worse. But what's always in the break room, you guys?
Snacks and
Delicious food.
desserts and coffee and donuts.
Yeah. So one of the things that we do, or what I do, is I go in and I help the companies write a policy change around healthy meetings and catered events. This doesn't mean that I'm like the dessert police. What it means is I help them to make the healthier choice. So that could be around, offering wraps instead of subs, or any type of catered lunch event. We tend to automatically order pizza or something that's unhealthy. We give them the tools that they need to make a healthier choice. And one of the items that we do use through DPH is a healthy meeting and event guide, which is really, really great. I don't have it with me, but that's one way DPH has helped us. Any questions? I know I'm probably babbling up here. All right, this is a quote that I love. It's from the Institute of Medicine. It is unreasonable to expect that people will change their behavior easily when so many forces in the social, cultural, and physical environment conspire against such change. So you're working toward a healthier behavior, but yet you're hitting a bunch of brick walls, because at every corner there's a Dunkin' Donuts. At every corner there's societal pressures. What?
McDonald's.
Oh yeah, McDonald's, fast food. That's a huge component. So anybody have any questions before I wrap up from the article or from the work that I do in the community? If there's anything I missed, I don't know if you have any questions.
I would like to go back, and you can finish up, and I want to bring the article up because I want to point out.
No, we can do that now. That's fine. I was just going to finish with my contact information if anybody had any questions.
What I would like to do is to, can I just end this?
Yeah.
I want to bring up that article because there's something in there that really spoke to me.
Yeah, please. The other thing, resource-wise, I go in and talk to the work sites and let them know that WellCOA is a great resource and it's free, and it's wellcoa.org. If you're ever interested in Worksite Wellness and want to look that up. So I basically bring them low or no cost programs to their work site. That is my focus.
I want to just emphasize kind of where the money comes from for all of these unhealthy behaviors that, and we all think that, oh well, it's not my problem, it's my neighbor's problem because my neighbor weighs 350 pounds, and if my neighbor doesn't want to live a healthy lifestyle, why would it even be something I want to consider?
That's a great one. It's a great component.
And why would it be something you'd want to consider? Anybody have any ideas?
Just for like health insurance costs and stuff like that. That goes up across the board if they have to cater to people who have more health issues. If you don't have any, you're still going to be paying whatever somebody else is paying, and they're the ones using all the getting all the benefits.
Right. So my health insurance is going to go up. Your health insurance is going to go up because someone else does not want to take care of themselves. And there was a really nice chart in here.
One of the driving issues right now with the Affordable Care Act is that they're trying to get the population that all of you are to sign up. And it's not happening as fast as they wanted. Why would they want you guys to sign up? Because you guys are healthy. Supposed to be healthy. You're supposed to push that money into the pool because that money The healthy money takes care of all the sick people. That's how it works with healthcare. And when you have a mandate, you know, it becomes a wishy-washy issue. Go ahead.
So what I wanted to point out over here, there's a little chart that says who pays for the cost of things that Angie was talking about, the obesity, the sugar, the diabetes costs,
Blood pressure, hypertension.
cholesterol, you know, cardiovascular issues. And 36% of the expenditure costs are borne by the federal government. Does the government make anything?
Which is pretty much our money, since we're tax-paying.
Where's the government get its money from?
We're tax-paying.
Us. Us. Okay. So there you go. There's one. That's your money. State and local government. They have a business. They make anything. They make a profit. Where do they get their money from? Us. Business and insurance. So you go and you buy something, and businesses have an increased cost of health insurance. So let's pick Kohl's, and so you go to Kohl's and you purchase something. How did they come up with price on their products? By how much it costs for them to do business, right? They have to pay for the product, plus the cost of their employees, the heat and the light for their buildings, right? The cost of their buildings. Oh, and guess what part of that cost is? Health insurance costs. So who's paying for that? You. We're all paying for it. As consumers, we're paying for it, the cost of the products that we purchase. Philanthropy, well, God bless those people who have enough money to give.
Yes.
But that's 5%. and individual healthcare consumers. Who's that? Us, right? So out of that 100% total,
We're all across the board except for that 5%.
we pay 95% of those healthcare costs.
And some of the biggest driving factors with the price of healthcare is the obesity epidemic right now, along with type 2 diabetes and then tobacco use. Tobacco is one of the huge problems that we're having, and you know, you find policy change around that and people get really upset. They say, you know, you can't tell me where to smoke. Go ahead.
I actually work for South Coast.
Yeah.
And they have the tobacco program thing.
That's right.
They're trying to get their employees not to smoke.
Breathe Better
Smoke
communities.
anywhere on the parameter. They actually had, one of the girls I work with actually said that somebody took a picture of her, a neighbor took a picture of her smoking and sent it to HR, and HR took it and went to the health insurance, and now her health insurance is going to go up a lot of money because they're implementing it. But the only downfall with that is they do it for the employees, they're enforcing it for the employees, but the patients are outside of the emergency room smoking like it's nobody's business. So
Well,
I think if they should enforce it, they should enforce it all around. But
they do have a great Breathe Better campaign. That's right. One of the things you have to remember about, there's a difference between an employee and a consumer. And when you have an organization that you represent, you have sort of this plan or this persona that you want to give to the community. And that's what you're representing. So you're not there represented as you know, yourself. You're there as an employee. And a good example that I like to talk about is the YMCA. The YMCA is like, you know, you're just supposed to be presenting yourself to the community as a good standing citizen, but more importantly, hopefully a healthy one, having good moral ethic code. Well, the South Coast YMCA, all of the South Coast YMCAs are my work site, and I meet with them monthly about implementing worksite wellness policies. One of the huge issues they have there is their employees walk in with big gulps. They're all soda fiends. And how do you tell your employee that you can't drink Mountain Dew? Well, what they're trying to do is, you know, this is a huge healthcare driver cost, is they're trying to tell them, okay, if you're going to choose to drink that item, you need to have it in a different concealed bottle. Because we can't tell you you can't have your cigarette or you can't have your soda or your junk food, but we can change it a little bit as far as how you're representing the organization. And so that's an example. And we haven't even, we changed around their healthy and meeting policy, and we changed around their tobacco policy in the employee handbook. We changed that. We've started a new culture of wellness. But one of the big issues there is their whole like big gulps and bringing in McDonald's. The employees will go out, this is only some of the sites, and they'll bring back McDonald's. And it's like you bring that in and these kids see it and you're telling them it's okay to eat that junk. And it is, it's junk. So.
And one of the other things, I'm all about cost, because that's part of my business part.
Numbers.
Of my brain.
Well, it's how you get your money. It's true.
Is that when you look at these numbers, heart disease, and I wasn't quite sure how to make out that annual cost for heart disease, but I want to say
in billions. It's in billions per year.
But it's 357.7.0. So I'm thinking it's $357.7 billion.
Yeah, it is.
Annual cost. And then alcohol abuse, back pain, lung disease, cancer, work injuries. But associated with heart disease, you have things, again, you go back to the cholesterol screening, the hypertension, all of those, $357.7 billion, and this was in 2004.
Yeah, this is an older article. I didn't want to bombard you guys.
Think about what we could do with $357 billion. What do you think we could do with it? Oh, wow. Yeah, we could do a lot of preventative things instead of, as you said, about the tertiary, whereas you're treating the illness and not coming up with prevention programs.
Yeah, you're going to be rewarded for having a healthier lifestyle. The big thing that I like to talk about is one day I hope my insurance company will pay for my running shoes, because it costs a lot of money to be healthy. It costs a lot of money for vegetables. It costs a lot of money for running shoes that work for your foot type so that you don't injure yourself, right? Who's going to pay for that? You do. I mean, they'll pay for your anti-inflammatory drugs when your knee blows out, when you're running, but they won't pay for your running shoes because you want to prevent the obesity. So I think this culture, which you're going to see more in your age group, is all about rewarding you for healthy behavior. So if you don't smoke, you're going to get a deduction, in your cost. If you exercise, if you have a gym membership, right now, I don't know what insurance company does not reimburse you for having a gym membership. They reimburse you, or they give you an extra $100 because you have a gym membership. They don't track if you go. They don't make sure if you go. Just having the gym membership is a huge factor. And the reason it is because they're trying to prevent these diseases, but they're also trying to create a culture of wellness. So.
I'm sorry.
No.
I just want.
No, those are great charts.
Yeah.
I mean, it's tough with the numbers, and I try not to, I didn't want to bore you guys with a lot of numbers, but those are the driving factors with healthcare costs. And more importantly, it's a driving factor with ROI, which is the return on investment. And so bringing these low or no cost programs to work sites is my main focus. But some of the small businesses within Fall River, they're hit the hardest because they don't have an HR department, but they also have only X amount of employees. So if they have one person that's out ill, who's going to make up that job? It's another person that's there, but they already have a job that's that's already taxed to the max. So you really have to think about the small business owner, and that's where I come in as far as the Worksite Wellness component. Does anybody have any questions? Yes.
I was wondering what some of the steps you can take for stress management, because I feel like just stress can come from a lot of different things, bad eating habits, or not sleeping right, or having abusing alcohol and smoking. If you're stressed out, those things are probably more of an issue. So what are some things you can do in the worksite to kind of decrease the stress of employees? What are steps you take for those?
Well, every worksite's different, so you kind of have to assess that worksite and figure out how that worksite's different and where you're going to meet the employee where they're at. Stress management techniques. You can really push for, what I tend to do is push for offering relaxation, but also offering, and this is something Janice can speak to, is chair massage on site. Chair massage. BCC used to, I've collaborated with the new person for chair massage here, but some of the students were able to go into the work sites and get their hours and whatnot for chair massage. But I would do relaxation. So I have one work site that we've done a relaxation area. They have an area at their work site where they're able to go, stress out employees, that they're able to go and sit. They have a chair in there and dim lighting. That's an option. Most work sites can't really do that though. That's actually a bank that does that. Another thing to do is to start a walking group. As we know, exercise increases endorphins. Endorphins make people happy. So what we tried to do is focus on a walking group on site. You can also offer an incentive. I didn't talk about incentives that much, but what we tend to do is people like to get rewarded for good behavior. So if you tie an incentive to any of your wellness programs, you're going to see a return. You may even have somebody come and actually educate your employees about stress and how it affects the body. And that may spring up some light bulbs in some of the employees so that they can say, hey, you know what, this is taxing on my body. I'm going to do something to change it. So we've done walking groups, we've done Couch to 5K programs, we've signed up a lot of work sites for the Fall River Fitness Challenge, we've done competitive teams, that type of thing. And incentives can range from a paid day off to iPads to money rules, to gift cards. What I like to do though is I stress, don't do a Dunkin' Donuts gift card. Do a Bob's gift card or a Kohl's gift card. So you can go buy that workout outfit or go buy yourself new clothes when you lose all that weight or whatever the goal is. You really want to think about how you're promoting and rewarding the wellness as far as the incentives are concerned. So I hope that answers your question. Stress management's a tough one.
Yeah.
And it also has to do with behavior change. You can't force people to change unless they want to. And so you have to meet them where they're at. So, any other questions?
So you said that it took sometimes 3 to 5 years,
Yep,
I think,
for ROI.
to see results.
To see a return on your investment.
I was wondering about the evaluation. How would you go about that? So do you just, after the program is implemented and stuff, do you just let it for a year or however long
Run itself.
and then how do you evaluate the changes?
Yep. So with every program that you have, what we try to tell the employer is that you want to survey the employees afterwards. You evaluate them. That's a huge issue too. I just finished the 8-week program, the tobacco program, and we evaluated them at the end, what worked, what didn't work. You know, that's where you're going to find out if you should prolong the program or if you should change it. You can do the survey or you can regroup with your wellness team. And again, that's why it's important to make sure you have all representation on your wellness team to find out what works and what doesn't work. How that's tied to ROI is, you know, if your healthcare costs drop, that's really the only way. Yeah. But you're going to find out what's working with your programs by participation. So, and you know, if you, things usually, I have one work site, it's the Family Service Association in Fall River. They've done a great job. They have a designated person though that runs all of the Worksite Wellness programs there. So that's another component, but they have to revamp it every year. They've done on-site farmers markets. They have a no smoking policy there. They've done fitness challenges. They've done walk-in clubs, and they've had some really great incentives That's a huge running factor to get participation. But to find out that ROI is to basically survey. And the programs itself, if you can't evaluate at the end of a program, so say you do your wellness goals and you run your Couch to 5K program, and then you survey everybody at the end, and you find out it's a total flop. And the reason it's total flop is because it's like, the program's at 7 o'clock in the morning, but that's the only thing that works. And, you find out all these kinks, so you run it the following year. You know what I mean? So you really have to kind of test the waters, but you can't really find out unless you survey. That's a huge factor. And then to get them to survey, to fill out the survey, you have to tie an incentive to that. Because if I handed out a survey to you at work, what are the odds that you're going to fill it out? Why would you? Right? So you have to think of all the stuff that plays into the bottom line, which is cost and dollars and cents. So.
And that's why it's important that things have to be measurable, so that you need to know where you're starting.
Which is that.
And then, in order to be able to assess what's not working or what's working, or what things you need to be changed, you wouldn't know that unless it became a measurable piece of
which is SMART goals. When you're writing a goal, and this goes for any of you, so say you decide, I'm going to quit smoking this year, or I'm going to lose 10 pounds. It needs to be specific, measurable, achievable, and reward and timely. So, achievable would be, or measurable would be, I'm going to get 50% of my work staff to quit smoking, or you got to tie a number to it. And hopefully you'll achieve that number, or maybe you'll achieve less, or maybe you'll achieve more. Who knows? But when you tie a number to it, it kind of pushes you for that ambition to keep going. So, and timely, so time.
You always have to have a time, so
time frame
to finish. All right, when are you going to stop the measurement? If you were going to just take it personally and said you were going to lose 5 pounds, well, do you want to lose 5 pounds in the next 3 months, or do you want to lose 5 pounds, whenever I lose them, I'll lose them, and maybe if I lose 5 pounds in 10 years, it's okay.
Yep.
So you want to make sure that it's timely and that you have that end date.
And they're incredibly tedious, SMART goals. We had to write many of them in college. But they're very important because they're specific and they're structured, and it gets you to your end destination. So just to keep that in mind. Any other questions, you guys?
I think mostly everything else you've answered.
Yeah. I'm trying to think what else for incentives that I haven't talked about. Oh, if you have an organization or a small business that doesn't really have any money to put down for incentives or anything to put into the program, how do you think you'd address that? Or what would be something that would help them to kind of incentivize the employees? And this is something that anybody would appreciate, I think. Starts with an R. What I'm thinking of, but if you're thinking of something else, that's fine too. So recognition is huge. And recognition is something that has no dollar sign next to it. And to be recognized as an employee is huge for some people. They don't want that necessarily that extra day off, or they don't really want that, I don't know, iPad or whatever. They want to be recognized, which, I think is a good thing. And it could be employee of the month or however you want to do it. But I think recognition far exceeds any monetary value, the research shows. Again, depends on the work site. So. Oh yeah, that's my information. If any of you have any questions or just want to drop me a message, email, telephone, and our website, gfrpartners.com, Greater Fall River Partners. We also have a Facebook page if you want to like it. Don't worry. We're a small organization, but we appreciate it. social media is key, and social media is what we're finding is another way to communicate with employees. So that's another big hot topic. But in any event, any other questions, comments? Well, thank you guys.